I'm Dr. Amy.
And I'm Ashley.
And we're going to get you back in the game. Hi, everyone. I'm Dr. Amy.
And I'm Ashley.
Ashley, what are we going to be talking about today?
Today we're going to be talking about a post-op rotator cuff rehabilitation for weeks 8 through 12. Dr. Canada, what can patients expect for weeks 8 through 12?
Oh, great question. So first of all, before we get into the expectations, I want to say congratulations that you've made it this far. If you've made it this far, you are on to what we are calling this advanced strengthening phase of the program. During the advanced strengthening phase, we're going to be talking about some very similar exercises that we've already given you and just adding some more weight or some more resistance than what you're already doing.
Great.
So before we get started on our exercises today, we wanted to point out a couple things about these bands. These exercise bands, which we've demonstrated before, are actually color-coded by resistance level. So they start out with yellow. Yellow is the least resistance, and that's where you're going to start with all these exercises, working your way up to the black. The black is the most resistant, and you'll find that as you work through these exercises, the last 2 reps of each set of exercise should be difficult. You'll start to feel your muscles ratcheting a little bit, knowing that they're getting fatigued, and that's where you want to be. Once those last 2 become easy, you're ready to move up to the next color, whether it's red, green, blue, and then up to black. Ashley's going to be demonstrating our first exercise today, which is our lat pull down. And one thing that you want to make sure that you do at home is you want to get as close to a door as you can. Make sure that the band is very well anchored on the door. Make sure your door is shut, nice and tight. And then what you're going to do is you're going to just focus on pulling your arms down and turning them into almost like we call it a goalpost. Isolating the movement right here to your back and shoulders. Now, the importance of the latissimus muscles is to really help strengthen the shoulder blade area, to pull those shoulder blades down and back. And when we have proper posture, especially in our shoulders with our shoulder blades, it takes pressure off the shoulder joint and keeps the muscles working at their best. So having strong back muscles and postural muscles are really, really important to the biomechanical function of your shoulder. As with all the exercises that we've demonstrated, you want to do about 10 to 12 reps to get tired. You want to do 2 to 3 sets of the 10 to 12 reps. One thing that I want to point out while Ashley's doing this is you'll notice that she's keeping her shoulders down. She's not shrugging her shoulders up and letting her shoulders go up towards her ears. She's keeping them nice and down and back. So that's the lat pull down. For our next exercise, we're going to be showing you an exercise called shoulder extensions. Extension of the shoulder is anything where your arm is going past the back of your body. So that's what we're going to be demonstrating today. You will notice that Ashley, as she's doing this exercise, has her palms up versus palms down. These exercises, you don't hike the shoulder, you keep them down, nice and down like Ashley is. Keep your posture of your back nice and straight, proper posture. Keeping the core engaged as you're doing it. Again, you're going to do 10 to 12 reps with 2 to 3 sets. All right, so for our next exercise, we're going to be doing what's called a bent over single-handed row. I know that's a lot to say, but if you think about it, bent over, single arm, and we're going to just do a row. So Ashley's going to demonstrate what to do. You're going to want to make sure that when you start this exercise, there's slight tension on the band already. You're going to just pull your arm straight back, keeping your shoulder down. As we mentioned in the other exercises, make sure you're not hiking your shoulder, keeping that shoulder down, keeping that arm close to your side. You'll notice also that Ashley's keeping really good posture as she does this. She's not slouched over. She's keeping her back nice and flat with her core, the core muscles engaged, and her knees slightly bent, so that all of the work is being done by the back of your arm. You're going to feel it also a little bit in the biceps muscle with that row, just a little bit. but the idea is to work the back of the shoulder. And like any of these exercises, you're going to want to do 10 to 12 reps, 2 to 3 sets of each to being fatigued or tired. So this is one of our favorites. It's called external rotation. We've shown you this before, but quite honestly, this is such a great exercise to really work your rotator cuff muscles that we're going to demonstrate it again using a different band. Again, you can add the resistance to the bands by changing up the color as you progress in these exercises. Biggest thing you want to make sure is keeping your elbow down by your side. And then Ashley's just going to externally rotate her hand, bringing her hand slightly up so that this really works the shoulder muscles of the rotator cuff that you're trying so hard to work on and get your strength back. You'll notice that when Ashley gets to the end of this activity, because she's using both bands together with her single arm, you'll notice that her muscle starts to shake a little bit, and that's good. She's getting a lot of work out of that shoulder, those shoulder muscles, working her rotator cuff muscles, and you'll see it's difficult, even just a few reps, right? Mm-hmm. Especially because she's really isolating the muscles. The smaller muscles of the rotator cuff, they will fatigue much easier than a larger muscle group like the biceps, where you've really got to work them to fatigue. They're such small stabilizing muscles of the shoulder that don't be surprised if you get tired with very little resistance band. That's okay. Great job, Ashley. You made it this far. This is the last exercise, and it's an oldie but a goodie, and it's just internal rotation, which is also can be very difficult when you're rehabbing your shoulder. Don't be surprised if you get tired really quickly with this one. This is a lot more difficult. You want to make sure that your plane of motion is, you're going to start kind of higher with your hand and work your way down towards your belly button. That's the proper kind of plane of motion with this internal rotation. You can do this with doubling up the bands if you get fatigued. I'm going to hold this band for Ashley so she can just do it with a single band. You can do it with a single band as well. The double banded with both handles is actually a little bit harder. So if you're ready for that, go for it. If you're not, then you can just use the single band. Again, with all these exercises, you're going to do 10 to 12 reps, 2 to 3 sets of each to fatigue.
So Dr. Canada, what can patients do if they don't feel that they're fully rehabilitated right now at the end of this video?
That's a really great question. So if you're struggling a little bit or you don't feel like you're as far along in your rehabilitation as you would like to be, first of all, consult with your surgeon. They're going to be the best ones to kind of give you some guidance as to what to expect based upon your exact procedure that you exactly had done. Some patients heal a little bit quicker, some heal a little bit slower. Give yourself a break. Plus or minus a couple weeks is not a big deal, but work with your surgeon, work with your therapist, and continue to make improvements. And if not, then they can give you some guidance, individualized guidance as to what to do next.
And again, as always, with these exercises we did here, go ahead and consult with your surgeon before doing any of these. We want to make sure that we're keeping you safe and not causing any harm here to your injury.
And again, congratulations, you've made it this far. So we hope that these exercises and the ones we've provided in other videos have helped you get back in the game